station.
Okay, ma'am.
Okay, so if you've read and understood, considering it critical care scenario, please tell me how would you manage this patient now?
Considering the scenario, I will manage the patient according to the ABCD protocol. I will repeatedly check the airway breathing and the circulation. Here I will check the blood pressure, heart rate, level of consciousness of the patient, urine output, if possible, and the clinically I will see the pallor, skin trigger, and the dryness of the tongue.
What of the tongue? Dryness of the tongue. Okay.
Yes, ma'am.
Yes. And?
Yeah, and I'll just secure the whiteboard cannula and start the crystallite fluid and blood to draw and send for the CBC, RBS, creatinine, electrolytes, ABG, and grouping.
Okay.
And I'll give the nasogastric suction of the patient, urinary catheter as well, and doing other investigation.
All right. What else is more important in this patient?
It's a case of acute abdomen.
Yes.
My focus towards the conservative treatment of the patient,
Yes.
as well as doing some investigation for confirmation my diagnosis.
Good.
For
Okay. What investigations would you in particularly do in order to diagnose this patient?
Yes, ma'am. I'll do the laboratory investigation, which I already mentioned, and then I'll do the radiological investigation, includes the plain X-ray abdomen, ultrasonogram of whole abdomen, and I also can do the CT scan of abdomen and pelvis.
Okay. After that, what is your plan of action? How do you plan, or how do you think of managing the patient?
It depends on my diagnosis.
Yes.
If the patient is the intestinal obstruction, I'll keep the patient nothing
by
per
mouth.
orally,
Okay. Yes.
nothing per mouth, NG suction, IV fluid, antibiotic, analgesic, catheterization, and monitoring the patient condition, vital condition.
Right. When would you decide, or when would you make the decision to go for surgical management?
Yes, if patient condition is deteriorate, if pain is increased, tenderness is increased, sign of peritonitis, or if any interabdominal abscess, then I consider the laparotomy.
Okay. This is the X-ray that you've got. Just suppose it's of the same patient. What would be your next step now? First of all, help me to read the X-ray.
This X-ray abdomen.
Yes.
Showing the air fluid level centrally placed in the abdomen.
Okay.
And some also observed in the peripheral part as well.
Right. Which shows what?
It's maybe case of the intestinal obstruction.
All right. Okay. So does it showing you dilated loops?
Yes, dilated bowel.
Bowels. Okay. And in this scenario, do you expect it to, okay, how would you differentiate it? From ileus? Intestinal obstruction from ileus, how would you differentiate it?
Yes, ma'am. In intestinal obstruction, the peristalsis working against the mechanical obstruction. And in case of paralytic ileus, peristalsis is absent due to the neuromuscular dysfunction.
Okay.
And in
And
radiologically,
yes,
in case of intestinal obstruction, there will be the air fluid level centrally placed in step-ladder pattern or either
yes.
in the peripherally pneumatic tile-like shadow.
Okay. And
But in case of paralytic ileus, there will be the dilated bowel
yes.
filled with gas and the fluid level.
In which condition bowel sounds will be present?
Yes, bowel sound will be present in case of the intestinal obstruction in eye and gate, not in the paralytic ileus.
Yes. So I wanted you to tell me because you said you'll be differentiating the patient or confirming your diagnosis on the
Yes,
basis
ma'am.
of your clinical examination. All right. Okay. Now tell me, when would you decide that antibiotics should be given to the patient?
Yes, if there is sign of infection or sepsis, they'll consider the
Sign.
antibiotic of the.
What is the sign now? What are
If
you
if
seeing?
if if I get the temperature in from
Okay.
clinically, if I get the temperature, if
Okay.
there is abdominal tenderness on investigation, if there is white cell count is raised, neutrophil count is raised, and CRP level is raised,
Okay. Then
then I'll
you'll get
consider
which
yes antibiotic
antibiotic would you
according
think
to
of
the local
giving?
test protocol, ma'am.
All right. Okay. Please tell me, when would you not go for, or when would you not decide to give cephalosporins? When you
Sorry,
should
ma'am.
not give cephalosporins?
Can't say, ma'am.
Okay. How would you take care of patients' fluid or nutritional status?
Yes, I'll talk with the dietitians about the nutritional status. I'll consider the total parenteral nutrition of the patient. It depends upon the patient's weight and the need of the patients. If the patient is normally 25 to 30 kilocalorie per kg per day, normal patient. If there is extensive trauma, we'll consider the 45 to 35 kilocalorie per kg per day, and additional glucose protein fats and fluid and electrolytes depends on the will be adjusted according to the blood report.
Okay. Where do you think, okay, this patient has come to your accident and emergency, but where do you think that this patient should be managed later on?
Yes, this patient I will mention the HDU.
High dependency unit,
Yes,
HDU.
yes, high
Okay.
dependency.
Why?
If patients, it's a acute condition, a patient, it's a case of acute abdomen, many
And
organ may be involved of the
okay,
patients.
how many organs can you see can be involved here?
Yes, ma'am, I had the GIT.
Okay, one.
Uh, GIT may be there, then a kidney may be involved also here.
How?
The patient having the vomiting.
Okay. So that means patient could be in. How would the arterial blood gases would be there? When patient is vomiting, then what should be the,
Patient having the hypochloremic metabolic alkalosis also
so it's
having,
alkalosis. So
yes,
which, okay, because of that you think kidneys can be involved.
yes, ma'am.
All right. Okay. How would you take care of patients deranged, or how would you take care of patients' arterial blood gases?
I'll do the ABG. The report may be the lactic acidosis. I will get low bicarbonate,
Okay.
low sodium, hypo level of potassium also uh, decline. Hypokalemia, hyponatremia,
So there'll be
lactic acidosis. Yes,
compensatory
yes, compensatory.
respiratory
Yes, respiratory. Yes,
system. Yes. Okay. Thank you.
thank you, ma'am.